Hello, my name is Alejandra Cerda, and today I will be performing the Central Line IV dressing change video. I am in appropriate school attire. My name badge is visible. I am free of any polish or jewelry. My hair is pulled back. For this video, I have my pen, my 2 masks. I'm going to say that they're both surgical for this video. My clean gloves, my sterile IV dressing change kit, and then my mannequin with this with the catheter, as well as I do not have an extra Tegaderm for this video, so I am using a plastic clean wrap and pretending that it is. Then I also have my trash bag. Okay, so first thing I would do is I would knock on the door. I would ask for permission to come in. Once given permission, I would perform hand hygiene. I would introduce myself to the patient. Hello, my name is Alejandra Cerda. Today I'm going to be your nurse. And then I would ask for 2 patient identifiers, such as name and date of birth. I will verify those identifiers with the patient's name band. After doing so, I would go ahead and explain the procedure to the patient. So today we are going to do a dressing change for your central IV. Then after explanation, I would ask if there's any questions. After addressing any questions, I would go ahead and perform hand hygiene, place my mask on myself, and then as well as place the mask on my patient. I would go ahead and perform hand hygiene again and put on my clean pair of gloves. For removing the current dressing, I want to make sure I use my non-dominant hand to stabilize the catheter. And then I want to make sure I start at the corners, all 4 corners, working my way inward towards the site and then pulling parallel with the skin and pulling inward towards the site. So we're going to start off 1 corner, okay, another corner, then another one, and then I would go ahead and pull towards the site. After doing so, I'm going to throw away my trash. I want to inspect the area for any redness, swelling, drainage, as well, or irritation of the skin. I want to check the tubing for any dislodgement or kinks, as well as I want to check the surrounding areas for any swelling, signs of irritation, drainage, redness, to check for integrity. Then I want to ask the patient if they're having any pain. After doing so, I would perform hand hygiene. I will get my sterile IV, my sterile dressing kit, and I want to make sure that I open it away from me, pinching at the corners to make sure that it stays open. I want to grab my pair of sterile gloves. And when I'm opening the gloves, I want to make sure that I am only opening it at the 1-inch border, not touching anything inside. Okay, so I got that. Opening it. Okay, I want to use my non-dominant hand and make sure I grab the cuff of the glove. I want to pull away or turn slightly, making sure I keep my eye on the sterile field at all times. So, okay, there we go. There's that one. Then I want to go ahead and put this one on as well, grabbing at the cuff. Okay, keeping my eye on the sterile field at all times. Okay, then I want to grab my chlorhexidine swab and my forceps, so pinch right here, grab that and this. Okay, so using my non-dominant hand, I'm going to be holding the forceps, and then when using the chlorhexidine swab, I'm going to go ahead and squeeze this and make sure that the entire pad is saturated with chlorhexidine. I'm going to go ahead and grab the catheter end right here. Okay, and then I am going to make sure that I am using a back and forth friction motion. If it was alcohol, I would be doing a circular motion, but because it's chlorhexidine, I want to do back and forth friction on each side for a total of 30 seconds. And then I want to make sure that I am cleaning the area for about the same size as my Tegaderm is going to be. So I'm going to go ahead and do that. So back and forth friction. So 1, 2, 3, back and forth, and then back and forth. And then after that, I'm going to go under the line. Okay, one swipe. Then I'm going to go on top of the line, another swipe. And then after doing so, I am going to go ahead and grab my Tegaderm dressing. I'm going to make sure I remove the backing. And then I want to make sure that I cover the entire site itself, and then make sure that there is no openings or no nothing that is lifted, nothing that can allow any germs or anything to get into. Alrighty. Okay, so after doing so, I'm going to remove this white border right here. Making sure everything is sealed properly when doing so. Alrighty. So after I do that, my dressing is in place. Then I want to get this white little tag right here. I want to put my initials and the time as well as the date. Alrighty, after doing so, I want to place this on, not on the site itself, but near the site, because I don't want to cover the site itself. I'm going to go ahead and place that right there on the side. It's not covering the site itself. Okay, and after doing so, I'm going to go ahead and pick up all my trash. Discard of my trash, remove my gloves in the trash. Then I am going to perform hand hygiene, remove my mask, remove my patient's mask. I'm going to go ahead and ask them if they have any questions, make sure they have everything they need within hand's reach, make sure the bed is at lowest position and they have their call bell within reach. Then I would go ahead and perform hand hygiene once again before exiting the room, and that is the end of this procedure.